Chikungunya cases of the infection have shot up over 20 times in the last week in Delhi. Doctors tell us they've never seen an outbreak of chikungunya so bad in the national capital region. Hospitals are full of patients, and as usual, the Aam Aadmi Party and the BJP are at each other's throats on who to blame for the crisis. We've got a wonderful panel with us this evening, some of Delhi's finest specialists to tell us about just how bad the situation is. Dr. Wali, medical consultant to the President, thank you very much, sir, for being with us. Dr. Naveen Dang, thank you, sir, of Dr. Dang's lab. Whenever anybody falls unwell, it seems everybody rushes to Dr. Dang because you know you'll get a test done quickly and hopefully reliably. Dr. Kate Chok, Director and Head of Department of Pediatrics at Fortis in Gurgaon, and the spokesperson of the Aam Aadmi Party, Reena Gupta. Dr. Dang, last 1 week, or more than the last 1 week, let's say the last 10 or 12 days, have you been overwhelmed by cases which turn out to be chikungunya?
Absolutely right, Vishnu. Last about 2 weeks have been bad, much more than what we expected. Patients coming with fever, patients coming with joint pains. On being tested, they've been found to be positive for chikungunya.
Could you give us some numbers in your one lab?
Well, in our lab, we are getting about 15 to 20 positives a day at least.
15 to 20 positives every day?
Every day.
And how many are testing, just as a matter of curiosity?
About 50 or so. 50.
And of the 50 or so with suspected chikungunya, you're getting 15 to 20?
Right.
I'll come to the other doctors in a moment. You know, I mean, this is just one clinic. Imagine the numbers elsewhere. This is one clinic which actually does the test. It's an expensive test. It's not done in many other places. Can you accept that it's a crisis?
Vishnu, first of all, the test is done in many clinics. It's not just this clinic.
Yes.
In fact, one of the first things that the Delhi government did was standardize the rates for the test, because it used to be a very expensive test and out of the reach of most people. So both the chikungunya and the dengue tests have been standardized, as well as the platelet count tests have been standardized. Secondly, the preparation, we knew that we've seen that MCD is being mismanaged since 8 years. We knew that things were not going to change this year. So preparations for dengue and chikungunya had been started from May onwards.
And why is it so bad?
Because this has just been a bad year. But that doesn't mean that the government is not prepared. We've opened some 400 fever clinics, and all these test results have been, and even now
chikungunya cases have shot up to 423, shot up by over 20 times in a week in Delhi.
Yes.
Despite all the steps that you've taken.
These are steps which, when one gets chikungunya, how do you deal with it? But to prevent chikungunya, the main thing has to be that you have to stop the stagnation of water.
And so you're going to blame the municipality?
No, I'm not going to blame the municipalities, all of us as well. I mean, we have to make sure that in our surroundings the water doesn't get stagnated. Firstly us, and then secondly the municipality, of course.
Dr. Chok, let's talk about children. How they are perhaps most vulnerable to this, and correct me if I'm wrong. Sure. It's children and those who are older. And what have you seen in your hospital, Fortis in Gurgaon?
Well, the numbers are just phenomenal, something that we never anticipated. The other is that I've been in this for a long time in this business, but we have never seen this kind of numbers over the past so many years.
In your career, doctor,
never.
And how many years have you been practicing as
30.
a doctor? In 30 years, you've never seen anything like this as far as chikungunya is concerned.
Even when dengue was so much there, probably numbers were at worst something equal to that.
Dr. Dan, in all your years of doing this, have you seen this kind of chikungunya?
Ever. Till last year, I'd hardly seen 2 to 3 positives or 3-4 positives in a year. This time, we are seeing, in the last 2 weeks, a phenomenal rise.
20 a day in your one clinic.
And I would like to point out to my esteemed colleague that when she talks about tests, there are 2 different kinds of tests which are performed. One is the real-time PCR test, which is specific, very much specific for this, and it is performed in the first 5 days of fever, and it gives with near 100% certainty the diagnosis. The other one is a rapid test which looks for antibodies that comes positive nearly about in the 2nd week of the disease. So what I am talking about only is patients who are coming to me early during the course of disease, and which is not very expensive. We are charging about 2200 for this test, and the cost to us is about 1500. So it is not an extremely prohibitively expensive test, and so people going for a people may be missing out, because remember one thing, chikungunya as such is mainly a clinical diagnosis. You may not go in for a test. A physician, a competent pediatrician can diagnose chikungunya without even getting the test done.
Okay.
This is what I am telling you is the tests which have been documented.
Right.
The tests which are going undocumented.
Dr. Bali, I think that's an important point.
Yes.
These numbers, they are shocking, but in fact, there'll be many more cases. People
Yes.
don't get tested, people don't get diagnosed properly, and people are suffering.
Yes, there is a huge suffering. When I sit in my morning OPD, every alternate patient I see walking with pain, bent down. That's the classical description of chikungunya, and keep telling them don't go for test, take rest and take medicine. See, the problem as compared to the dengue, the chikungunya virus can stay in an animal like a rodent, in cattle, and in some other species like squirrels and some other animals, so that we have more chances of this being bitten by a mosquito and then mosquito biting the human being. That's the one of the reasons I'm trying to say for a little bit, one of the reasons that the disproportionate cases of chikungunya are coming. And I tell you, I'm telling with great pain that for us it is very easy to tell patients, do not panic, just take paracetamol, go home and take rest. But if you see the apathy and pain and agony of the patient, and not only the patient, his whole family, and the suffering and the disability and the pain and the loss of working hours coupled together is a big pain to me as a doctor. And I would definitely do more than that. I would probably make sure that it is not dengue, give some injectable pain relief. In a very short number of cases, may give a little bit of small dose of steroid, which is controversial. I would not touch that. But make the patient pain free. Pain is the most killing, most devastating, most disabling and most painful to look at symptom in a given patient of chikungunya, which by definition means a bent man.